Khurumjari, MitSna na mayambu taramna okchari. MitSna wakhal manaba nahasingna Manipurgi education system bu global standard ta thangatnaba hotnariba non-profit organization amani. MitSna na ngasi phawbada career amadi education ga mari lainaba activities amadi events kaya pangthokre. Asigumba educational amadi career ga mari lainaba activities kaya bu puthokpa ngamnabagidamakta MitSna na mayamdagi mating nijeri. Ngasigi event asisu minungshi.com na MitSna dating bang birakpani. Ngasigi event Beyond the Door Clinical Psychology Career and Understanding Stretch Management hariba session asigi host Ahak Chitan Balaraj Kumari na host oijagani. Aduga Clinical Psychologist Che Miranda ngakpigani Miranda Yandrembam na speaker oigani. Ngasigi program asida maru oina handakta haidokriba 10 exam amadi 12 exam gi results sing kramaina students sing na cop up tawgadage amadi career clinical psychologist karamna oigdage kari criteria changi amadi hausi COVID-19 na thokhalakba pandemic asida mental health problem kaya ama lagli masisu kamaina cop up tawgadage haibagi matangda nainajagani. Ngasigi speaker Che Miranda akoi nakta negsinduna leire chichebu welcome to minasi.
Good evening, ma'am. I huzikpuri Chitan Balan introduced Miranda Yandrembam, clinical psychologist. Oinai practice story. Ngasigi matang se MitSna na sumaina platform ama puthoakanda naharol singidamakta for the youth students the kanaba hangnabagidamagta sumaina silise. I'm really thankful and I'm really glad. Aina ayaba aina angamba awareness knowledge aina akhangba career related poirasu exam related stress poirasu aina adum ngamnaba mayamda cater tawdaba khonajage. So I hope this session, this segment will be very beneficial to everyone who's going to be watching or who's watching right now. Yes, now Chitan Balaso, let's start.
Hi, Chichi, na ako yung MitSna bu nungsibigi da bagtayam na thagachari Chichi. Ado Chichi, haidi haudringa manajum conversation wina icham na dum Chichi chatminasi. Aduga viewer miyam dasu akoy na chathazariba event nasiga mari laina na hangbining ba comment natraga any related mental health issue or career ki matang da hangbining ba lege tardi mayam comment pibirau akoy gi conversation Chichi ga ega chathaga jadariba conversation asigi aroi bada Chichi na mayam gi comment na do entertain tawjagani. Chichi, kamain to birige pandemic mark sibo. Haidi kamain tawraga len birige Chichi.
Pandemic say it has been quite productive high tare phase of my life high tare ko mental health ki issues se am kanna kano tore yam na invoke high tare in high tare because of school college everything has been locked down aduga education degi ni khang de thabak degi kai degi khoi gi mode of teaching hongakpa online gi lakpa and then hamba lockdown to ki badadi mayam se ko pura holiday mode tabudi leki but sum heja lakpadagi mayam se kai haitare ka dawdoino habagi pakhatpa kamaina bu tawdoino how our future will be uncertainty am attached to torakpado so senior sumaram oirakanda hadi students in the career related oirakpa angang sing exam thagadaba competitive exam thagadaba so moi sing se stress lakpa hoba because exam se kamain tawdoino khotoino for example huje JEE IIT adegi net UG gi postpone tawkiba not just that even UPSC exam CDS exam postpone tawkiba khotkiba normal timing degi oidaba so this has all created a very anxiety marom da mayam sida high tare so mental health issue stress wang bana maram oirakanda angang singda yamna sigumba issue mala hanba sida khoi so we had to like intervene haitare ko angamba yaraga
Hoi
koina
chiche.
su puthokanda on social media ni khangre natra kainona ni khangde koina su angamba kaino tauba help tauba ase aduga online counseling dani khangde via telephone counseling dani khangde koina mating angamba panba adegi covid-19 ni matangda koina hujik phawbada vaccine puthokri khotri habegi pakhatpa chamangnaba angang singse pick ibangang daina adolescents and then koi social media da koi se information overloading tau thokba hai
Hoi
tare
chiche.
hujikti amu since it's been 4 months almost 4 months khagadi phaba hore aina sum yengba matamda haidi covid-19 is only approved oiba authentic oiba source agi khangbiyo social media da whatsapp da circulate torpa message da khanbi ganu now and then newspaper da sulai but we should always be referring to WHO natraka and ICMR gi kaino da oina khatang yengbiyo ana mayamna haibanina hujiksu so I'm sure public is getting a little hadi kitang aware oire na idum lawzare sigi matang de
Hoi chiche. Hoi chiche hoi gumba clinical psychologist mayam ama leibadagi su mayam yamna pakhatnadabani na silawjay chiche bu sige platform se lawraga chiche hoi gumba warrior frontline warrior kya mayam bu thagatpa phongdokchari chiche. Ado chiche ihan hanbada aina khangjaningi se haidi clinical psychologist haibasi kaino aduga karamba area se clinical psychologist ki makhada changi haibasi amtang haibi biyagadra.
Yes. Clinical psychologist hai se koi licensed hai tare ko she say license amane to practice duga koi mental health disorder laiba mental illness laiba mayam da koina practice tawba yaba practice in the sense in the form of kari wakhal gi anaba se mental illness there are so many different forms of mental illness adu karamba na bano haibado adu koi diagnose tawba via our psychological tools and case formulation my detailed history laura kanda and then akoi dugi matungi na kai treatment piba yai haibado akoi na tawi clinical psychologist say mental health professional ne ama haitar mental health professional haira kanda akoi umbrella teamwork ama oeba there has to be a psychiatrist there has to be a clinical psychologist there has to be a psychiatric social worker who will be working at the community level and then last ta koi psychiatric nurses sumain team moina layeba so clinical psychologist hai se koi mayam na khangna badadi counseling tawba oina chatle mayam na khangna bada but it koi loina mak tawi psychiatrist amaga clinical psychologist ka khena base kain haba matamda clinical psychologist does not have a MBBS degree but they are licensed to practice psychotherapy and other forms of psychotherapy makhal mayam ama leire adu practice tawba aduga amuk sigisina amuk kanana govern tawge haba matamda khoigi MBBS license so we say we have Medical Council of India. Likewise, we have Rehabilitation Council of India who magi makhada recognized over institute khara leiriba adugi matungina akoi MPhil in clinical psychology se tamgadabaneba 2 years training ne khoina tamise after your masters after you get a degree in masters in psychology and then you pursue MPhil in clinical psychology then you get the license as a clinical psychologist India dadi dumaina taweba so that is how
In short chiche na haibi in short, chiche na haibi say clinical psychologist as a doctor adu katang na it's a teamwork neba chiche na ka haibi ning say na tra
clinical psychologist as a professional mental health professional amani but the mental health team haragana we will team mo in a chatle haba psychiatrist ne clinical psychologist ne psychiatric social worker ne do psychiatric nurses hana the my team mo in a chatle ba but clinical psychologist ki role to be psychotherapy khoi gi diagnostic ke ka tawba for any mental health illness haibagi kaino do adu do way the only difference is we cannot prescribe drugs whereas the psychiatrist prescribe drugs difference is that kai haiter khoi clinical psychology tamak pa so khoi gi kaino se loin tamakani ba ki matang so drugs related kaino be se loin tamakni and then even the MD psychiatry also they also have the same psychotherapy matang loin tamni ba but they specialize in giving treatment drug related adu akhoi na muk psychotherapy counseling ana chatpa sida oina akhoi na muk specialize tawba so the only difference
Hoi chiche makasa tabi wa ina interrupt tawgre
no it's okay let's carry on
ꯍꯥꯏꯗꯤ ꯃꯊꯪ ꯑꯩꯅ ꯈꯪꯅꯤꯡꯉꯤꯁꯤꯅ ꯀꯔꯤ ꯀꯔꯤ ꯀ꯭ꯔꯥꯏꯇꯦꯔꯤꯌꯥꯗꯤ ꯆꯪꯉꯤ ꯀ꯭ꯂꯤꯅꯤꯀꯦꯜ ꯁꯥꯏꯀꯣꯂꯣꯖꯤꯁ ꯑꯃ ꯑꯣꯏꯕꯒꯤ ꯃꯇꯥꯡꯗ ꯍꯥꯏꯗꯤ ꯑꯩꯈꯣꯏ ꯏꯟꯖꯤꯅꯤꯌꯔ ꯑꯃ ꯑꯣꯏ ꯍꯥꯏꯇꯥꯔꯗꯤ ꯕꯤ ꯇꯦꯛ ꯗꯤꯒ꯭ꯔꯤꯕꯨ ꯆꯪꯕ ꯑꯗꯒꯤ ꯗꯣꯛꯇꯔ ꯍꯥꯏꯁꯨ MBBS ꯗꯤꯒ꯭ꯔꯤ ꯑꯃ ꯀꯝꯄꯜꯁꯔꯤ ꯑꯃꯃꯝ ꯑꯣꯏꯅꯩꯗꯅ ꯑꯗꯣ ꯀ꯭ꯂꯤꯅꯤꯀꯦꯜ ꯁꯥꯏꯀꯣꯂꯣꯖꯤꯁ ꯑꯃ ꯑꯣꯏꯒꯦ ꯍꯥꯏꯇꯥꯔꯗꯤ ꯀꯔꯝꯕ ꯗꯤꯒ꯭ꯔꯤꯁꯦ ꯀꯝꯄꯜꯁꯔꯤ ꯑꯣꯏ ꯀꯩ ꯗꯤꯒ꯭ꯔꯤ ꯄꯥꯏꯗꯒ ꯌꯥꯗꯒꯦ ꯍꯥꯏꯕꯁꯤꯃ ꯆꯤꯆꯦꯅ ꯑꯝꯇꯪ ꯍꯥꯏꯕꯤꯌꯨ
You need to finish your masters in psychology. Psychology the khatang
Okay.
atopa subject de yaad hai. And then you have to kaino da aduga MPhil in clinical psychology se RCI recognized institute amda tamgadaba. For example, we have RIMS
Okay.
Manipur da ko. We have IBAS in Delhi. We have MIT University in Noida, and we have Manipal University. We have we have Rinpas na Leko Ranchi. Ranchi. Yes. So these are certain institutes, and of course NIMHANS, one of the top institutes for studying MPhil in clinical psychology. NIMHANS na top ni. So ma na kayo
Enhanced
to
Bangalore.
yeah. So MPhil in clinical psychology say tamba maruni for getting a clinical psychologist degree, but you need to have a master's degree in psychology. Nang organization, you can have any specialization during your masters. You could have gone for organizational behavior oitar, so you can still pursue MPhil in clinical psychology with requirement marks with 55 percentage. Ayambalo in institutes in oeba. And then of course there are some
Okay.
criteria for SC/ST kitang relaxation pi budi khara budi oi. So nangi masters level of 55% yogadaba adu laibane, but it varies from institute to institute adugumba khara lai.
Okay, Chiche. I'm nungayjay. Ado Chiche, Chiche gi site mo kitang lakchage. Haidi akoy Manipuri singse anambana akoy gaise akoy na chatliba career line se yamna mainstream oyeba. Haidi mama pa sing sungare loina ma anambana medical dang tamde yade haibagumba engineer katang oyde yade haibagumba yamna typical oiba mindset ama loi layeba ko. Ado Chiche na sigumbage barrier ma'am se lalaga clinical psychologist se kamaina khanbirak no Chiche. Oike haibagi personal.
I think my parents have been very secular. High tareko,
Okay.
very liberal, very
Very lucky.
liberal.
Chiche, I'm
Yeah,
lucky hoy
very
haini.
lucky. They have always, pushed me to do anything that I wanted. Ko. In fact, I was doing
Okay.
economic honors in my college, but then I did alternate subjects in psychology, law baneba. But I had more inclination
Chiche.
towards psychology because economics se dum tame haja waiwani. Of course, it is important subject ni na, but psychology se ke doge haba matanda. It was relating to humans. Me se kamai to we ko how relationships akoi ki me social skills ki matanda akoi motivation se kamai to we akoi memory kamai to we kind of sum tamakpa horak padagi. I was like more inclined towards psychology. So then I started shifted my gears to psychology honors ko in my college level. The
Okay,
minor
Chiche.
so my parents have been very liberal, adu gihai tardi, and they have always supported me in whatever I wanted to do. In fact, masters matam dasu, I still did not have any gihai tar. I say master da clinical psychology. I say organizational behavior rom da hadi human kaino HR rom da chatpagi kaino ina laigi human resource
Hoy,
management
Chiche.
rom organizational behavior mainly deals with human HR gumba department deal taweba. So
Hoy.
kedogam tam adu kanina se dum lairamba, but when I started doing my masters and when I started taking up kahani clinical oiba paper khara yawba horakado, then ade dum khangba horakado that this is something I was like very interested on. Adudagi, and my exposure came when I did my internship at RIMS clinical psychology department. I
Okay.
did that time only had I
Ah.
want exposure phangbo. First thing I said by the convenience ki damakta di yung dalay bagi 50 days period to tawbaneba. Ako'y fill work important bagi. But when I got there, I got a real exposure of how, how really clinical psychology is. Understanding the phazna phangakpado. And of course, ako'y maitay abi adagi ako'y kamaina tawi ako'y anaba Manipurda layriba problem, Manipurda layriba issue, mental health ki kaino stigma ni hagi hirasu layday ni aduga layriba problem karam bano kay kahase khara manung khutna changba natraga I got a deeper understanding how
Sorry.
my state is with regards to mental health issues. Adudaiso hauna aingondasu yam nungaiba phawgibado aduga aingonda kay haini case ka pahalakpa matamda aingonda case tunaga yamna phajana reciprocate tawrokhtanaga tawrokhibadudu. That was a very fulfilling experience for me. So that is when I decided that I'll only do MPhil in clinical psychology from RIMS. I didn't apply anywhere else right after my master's. I Bhas in Nimhan, they are the top institutes. I never thought of applying because I culture ki understanding se I yumda I RIMS da tamagana henna phangani haibagi khambadu imonda leizabado. Akhoi culture specific behavior su yam oiba adugidamakta. So that's how my tryst with clinical psychology is, and here I am now practicing clinical psychology.
Yam nungai chiche haidi goal se pura hekto oriented oibe na team midway da laga yamna pamcharaga smana pursue
Yes.
to giving successful oire
Yeah.
tab da su yam nungai chiche chiche
No, I'm still
chiche na
struggling.
haidi su
I'm still learning. I'm still
okay
learning. I'm still
they are
learning.
so hoi ado chi kaino haidi chiche na mana thengnarappadagi midway dagi lakpane budi hairibako ado tar chiche na sum thengnarappada role model gumba inspire tawgiba mi gadi thengnabirappa haidi clinical psychologist
Clinical psychologist. When I was in my college, college ke professors they were like so vibrant and so understanding. Hi dar typical kind of oi rakta badu khambra. Adi yam thina yam nungai badu khadi yam approachable so oi rakpa psychology teachers and I really like that vibe mogi personality singdo. So that was one influence. Hi dar. But clinical psychology the pura kino manung kino ina changhan ge hi bata di role model as such lady because have I'm still learning, but as agi oja singh se clinical psychology tamakpa matamda RIMS department da khoi oja singh se they moi se yamna thagani in any way they have helped mingoina lawjabu dasu professor Dr. R.K. Lenin, Sir Haramani, Dr. Ramani, Dr. Guten, and then Samita Ngairangam kind of lay, and then Dr. Roshan kind of lay oza. So they have these people have influenced me in one way or the other. These have been very influential, but particularly high the role model high tardy. If you come back, clinical psychologists in natte ba oza sindo. They were like psychologists, they were professors, academician high tare. Do tarasu clinical psychologist makti natte. But since we have come up with a role model topic, but there has been personalities who have like yamna aingonda kaino tawgibado yamna touch tawgiba hai tare ko that I really want to be somebody like her, like him kind tawbodo. That was when Nimhansta ina akoi say 3 months ki training thai ba neuropsychology da because we don't have a neuropsychology unit at RIMS, so we as a part of the course 3 months ki thai ba adu matamda Nimhanski oza kaino leiba Nimhansky oza Keshav ana Sir Keshav ana ma leigiba. So ma se yam thina yamna calm oraga yamna kai haitare the way he approach the subject, the client patient approach tawba, and the way koi history kaino tawba khotpa so yam tamjaningai oigi. So that is one influential person in my life haitare ko yamna aingonda magi smai oiningi kaina khangibado.
Yam nungai chiche ado chiche se schooling di kai daga tawbirake chiche haidi Manipur manung dadum tawbirakpra Manipur mapan tawbirakpra haidi college pudi ai DU da chiche na master bau tawre haiba makhangjare MPhil da mu Manipur da ado schooling di kadai wai da tawbirake chiche
schooling se class 4 bau sai Maria Montessori tam then 5 to 12 I was in Kolkata Julian Day School haiba amalai ko aduda I se tam Elgin Rota. Because my father was posted in Kolkata, so basically I was studying as a day scholar. Adu gi matamda adu so schooling na Kolkata, and then mathang mapanda dum lai, and then mapanda sum lera abanina kaino do kui yumda lakpa yumda kaino to basidi yamna nungaire and yumda su dum leirage na khalle mapanda chatpagi kaino simadi kya leitre aina tamjaruba akhangba ahaiba aina adum cater to ngamge mayamgi seba tawki na dum khalle smain tawrakanda oina
Retire hoje chiche yum do enjoy tawre
yum no enjoy tare yum nungai be like ko na
the express opportunity ma pire yum da enjoy tawbagi ko chiche
yes
hoi mathang se chiche haidi chiche gi experience haidi master MPhil tawrapa matamda chiche na hoje clinical hoi hapeti panbi kre ko chiche da smaina tawraktana haidi chiche gi scores khara lakpada numit kharani lakpadagi hena panghibani khotkibani chichena khardi pandikreba doitarsu elaborately chichena experience master MPhil da clinical psychologist am oige habagi lines da khongdarakpada chichena thengna birakpa experience myam do kitang na share to biya gadra
ꯌꯥꯏ ꯇꯧꯖꯔꯛꯀꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯩꯅ ꯑꯗꯨꯝ ꯍꯥꯏꯕꯗꯣ ꯍꯥꯏꯗꯤ ꯑꯩꯒꯤ ꯃꯥꯁꯇꯔꯁꯇ ꯑꯩꯒꯤ ꯀꯩꯅꯣꯁꯦ ꯍꯧꯖꯤꯛꯀꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯩꯅ ꯇꯝꯃꯛꯄ ꯄꯦꯄꯔ ꯂꯧꯔꯛꯄ ꯄꯦꯄꯔꯁꯤꯡꯗꯣ ꯑꯩꯅ ꯌꯥꯝꯅ ꯏꯟꯇꯔꯦꯁꯇꯤꯡ ꯑꯣꯏꯈꯤꯕ ꯕꯤꯀꯣꯁ ꯃꯥꯁꯇꯔ ꯏꯁ ꯑꯣꯜꯋꯦꯁ ꯑꯕꯥꯎꯠ ꯊꯤꯑꯣꯔꯤ ꯑꯌꯥꯝꯕꯗ ꯑꯦꯝꯐꯤꯜꯗꯕꯨꯗꯤ ꯄꯨꯔꯥ ꯑꯩꯈꯣꯏꯁꯦ ꯇ꯭ꯔꯦꯅꯤꯡꯒꯤ ꯃꯑꯣꯡ ꯑꯃꯅꯦꯕ ꯀ꯭ꯂꯥꯏꯟꯠ ꯀꯃꯥꯏꯅ ꯍꯦꯟꯗꯜ ꯇꯧꯒꯅꯤ ꯄꯦꯁꯦꯟꯠ ꯀꯃꯥꯏꯅ ꯍꯦꯟꯗꯜ ꯇꯧꯒꯅꯤ ꯀꯃꯥꯏꯅ ꯃꯣꯏ ꯀꯦꯁ ꯍꯤꯁꯇ꯭ꯔꯤ ꯂꯧꯒꯅꯤ ꯀꯃꯥꯏꯅ ꯀꯔꯝꯕ ꯑꯅꯥꯕꯅꯣ ꯀꯥꯎꯟꯁꯤꯂꯤꯡ ꯀꯃꯥꯏꯅ ꯇꯧꯒꯅꯤ ꯑꯅꯥꯕ ꯃꯈꯜ ꯃꯈꯜꯗꯨꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯍꯥꯏꯅ ꯂꯥꯛꯄꯗꯣ ꯑꯗꯨꯗꯒꯤꯁꯨ ꯑꯣꯏꯈꯤ ꯑꯗꯨꯒ ꯀꯩ ꯍꯥꯏꯅꯤ ꯑꯩꯅ ꯍꯧꯖꯤꯛ ꯇ꯭ꯔꯤꯝꯁꯇ ꯂꯩꯈꯤꯕ ꯑꯦꯛꯁꯄꯣꯖꯔꯗꯣ ꯑꯗꯨꯒ ꯀ꯭ꯂꯥꯏꯟꯠ ꯃꯈꯜ ꯃꯈꯜ ꯊꯦꯡꯅꯔꯛꯄꯁꯤꯡꯗꯣ ꯕꯤꯠ ꯋꯤꯠ ꯑ ꯆꯥꯏꯜด์ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯑꯉꯥꯡ ꯊꯦꯡꯅꯔꯛꯄ ꯑꯉꯥꯡꯁꯦ ꯃꯈꯨꯠ ꯌꯥꯝ ꯂꯦꯡꯕ ꯑꯉꯥꯡꯒ ꯊꯦꯡꯅꯔꯛꯄ and then ꯑꯗꯨꯒꯤ IQ test ꯑꯗꯒꯤ ꯃꯥꯒꯤ psychodagnosticꯀ ꯇꯧꯍꯟꯕ ꯈꯣꯠꯍꯟꯕ so that was the real exposure that I had for the first time ꯑꯗꯨꯅ ꯌꯥꯝꯅ ꯑꯩꯉꯣꯟꯗ ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏꯈꯤꯕ ꯑꯃ ꯑꯣꯏꯕ ꯑꯉꯥꯡꯁꯤꯡ ꯂꯣꯏꯅꯕ ꯑꯗꯒꯤ ꯏꯟꯈꯠꯂꯛꯄ ꯅꯍꯥꯔꯣꯜꯁꯤꯡꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯩ ꯍꯥꯏꯇꯥꯔꯦ ꯗꯤꯄ꯭ꯔꯦꯁꯟꯒꯨꯝꯕ ꯂꯥꯛꯄ ꯈꯣꯠꯄ ꯇꯧꯕꯒꯤꯁꯤꯡꯗ ꯑꯩꯈꯣꯏꯅ ꯑꯩꯅꯒ ꯍꯦꯟꯗꯜ ꯇꯧꯕ ꯉꯝꯈꯤꯕ so ꯑꯗꯨꯒꯤꯗꯨꯅ ꯌꯥꯝꯅ ꯅꯨꯡꯉꯥꯏꯈꯤꯕ fulfilling ꯑꯣꯏꯈꯤꯕꯩꯁꯨ ꯑꯩꯉꯣꯟꯗ ꯍꯦꯟꯅ motivate ꯇꯧꯕ ꯍꯥꯏꯇꯥꯔꯦ that this is something that I really want to do further ꯌꯨꯝꯗ ꯑꯣꯏꯅ ꯈꯜꯂꯒ ꯑꯗꯨꯃꯥꯏꯅ ꯇꯧꯕꯅꯦꯕ
Okay, Chichi. Chichi, Chichi se, how's PhD se, I MU the tawe hena tajai ko Chichi. MU the Chichi na
yes
haidi anthropology department the tawe na tai. The Chichi na psychology line
yeah
degi la aga amo pura different to ba anthropology lom da PhD tawe bagi maram se na Chichi kai gi oito no. Haidi related oibra na
pura
traga.
related way it's an allied subject see
Okay,
this is
Chichi.
something that I am always asked about that why you're doing it first of all there was no psychology department when I wanted to do my PhD I 2017 dai tawrakpaneba do kedoge haba matamda anthropology studies go culture study taweba and psychology studies human behavior culture ga khoi gi chatnabi lonchat akhoi na tawriba mong matau khoi mai gi thainidagi hauna akhoi se huji bhawba akhoi na laiba mong matau se it shapes our mental health akhoi na khalliba mong matau akhoi gi attitude akhoi na lariba mong matau sing se yamna kai haidar shape taweba so anthropology sina you are trying to study the culture point of view aduga psychology sina human behavior se kamain tawge haibaduneba so I'm bringing in both the aspects to study akogi manipur da gi chatnabi lonchat na kamaina suppose for example I'm doing my research in adolescents drug user so I'm trying to study ko mogi behavior se kamain tawge na see akoi manipur di youth thakpa se khangabra nupa thokpa thabak ne na haeba nupa
Oh,
maja sing
Chichi.
se drug users
Yam
they
chokok
feel
say,
that associate
yam chokok
yes
say,
I'm
chokok
talking
thing na
they don't see it as a problem ꯑꯗꯨꯗꯣ ꯑꯩꯈꯣꯏꯒꯤ ꯂꯥꯏꯐꯀꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯀꯣꯞꯇꯣ ꯃꯣꯏꯁꯦ ꯑꯦꯗꯣꯂꯦꯁꯦꯟꯁ ꯍꯥꯏꯁꯦ ꯌꯥꯝ ꯇꯦꯝꯄꯇꯤꯡ ꯑꯣꯏꯕ ꯃꯇꯝꯅꯦꯕ ꯇꯨ try out different drugs like ko cigarette-ꯄꯨꯅꯤ ꯍꯥꯏꯔꯁꯨ ꯅꯠꯇ꯭ꯔꯒ cannabis-ꯅꯤ ꯍꯥꯏꯔꯁꯨ alcohol-ꯄꯨꯅꯦꯕꯨ ꯍꯥꯏꯔꯁꯨ so they feel that they do it because ꯀꯩ ꯍꯥꯏꯇꯥꯔꯦ ꯅꯨꯄꯥ ꯊꯣꯛꯄ ꯊꯕꯛꯅꯤ ꯍꯥꯏꯔꯒ knowingly unknowingly ꯃꯣꯏꯗ ꯀꯣꯟ effect ꯂꯥꯛꯀꯅꯤ ꯍꯥꯏꯕꯗꯣꯀꯣ ꯑꯗꯨꯒꯤ so ꯁꯨꯃꯥꯏꯅ ꯇꯧꯕ behavior-ꯁꯦ ꯀꯔꯥꯏꯗꯒꯤ ꯂꯥꯛꯀꯦ ꯍꯥꯏꯕ ꯃꯇꯝꯗ we belong from a patriarchy society ꯑꯩꯈꯣꯏꯒꯤ ꯀꯩ ꯍꯥꯏꯇꯥꯔꯦ ꯌꯨ ꯊꯛꯄꯒꯤ ꯀꯩꯅꯣꯁꯦ ꯇ꯭ꯔꯦꯟꯁꯦ ꯑꯗꯨꯝ ꯊꯥꯏꯅꯗꯒꯤꯁꯨ ꯂꯩꯔꯛꯄꯒꯤꯁꯨ ꯑꯣꯏꯕ one factor ko aduga akhoi ahan akhoi kainosingse adum thakpa khotpa urakpasna su moidaisu adum observational learning moidigisu adum tamkhiba ama oiba so aduna one reason is kai haini sumaina koi patriarchy society ni na nupa thopani na kem kai de kai naga chakibado since my father is drinking my uncle is drinking so it's okay for me to drink nupa thoppa thabak ni ka haraga tumaina taubaneba okay so this is one thing so anthropology will bring in the cultural aspects and psychology will bring in the the human behavior see akhoi na lai ba akhoi manipur gi se ko thaina dagi hauna the kind of exposure that we have been into ko akhoi se dum akhoi gi se society se protest ni khangde violent ni khangde right since childhood nang so I show khoi dum ore ko outsider amana sigi point of view understand to se khatang wan thokni ba ko hadi ka haiba matamda moina akhoi chatnariba mayam se akhoi gi maitai ozam na khangba dumaina kanamta na su understand tawreba akhoi gi chatnabi lon chatagi akhoi na tawri se kaino aspa gi matang dani khangde ILP gi matang dani khangde they won't understand such akhoi gi exposure akhoi gi behavioral kaino lai se kari maram gi no haiba se so I needed somebody who would be able to guide me through aduga smine torakanda understanding cultural understanding su lehenna ba to explain the akoigi human behavior se sigi da maktani dai na main oina tawri sidi
Okay, like that is in short chichena haibining is and is interrelated oibanina chichena pursue to given neighbor
yes
go PhD se.
mm.
Okay, thank you very much. Chiche
Yeah.
koi ko se ai samak so student na manen mayamam so imanabi sum thengna ba or even juniors mayamam so thengna ba yaw jay ba haidi psychology the bachelor's se pursue to salure ba adu immediate master tawge have se moi se psychologist master dum tawgadra natraga haidi moi da chamam na ba ma haidi sure ba kam da ba ma lay ba ko shigumba students mayam study chiche na kai advice pb ning ke chiche
amtaga repeat tawbirawa khatang tatle egi kaino amtaga repeat tawbirawa
Kaisu kaide chiche haidi student mayam ama lay ba ko hana hozik moi psychology da graduation tawzari ba aduga kai dawra hozik se moi master se psychology da dum continue tawge habi se moi se kitang doubtful loiraga natraga tawsira tawroshira natraga to pa kaino ma yigsira habi moi da chamam na bak mayam ama ui ba ko sigumba student sing se da chiche na kai advice bibi ning ke habi du mata na kitang panbiyo chiche
Okay, psychology se BSc da tamaka mogi graduation tamaka da master do tamgadra tamoja haibadune ba see psychology se kaino tawe nang yam interesting oitadi sada yam na passionate oitadi ko yam adum pursue to biyo trust me, it will always be very helpful. In fact, psychology is on a very personal level. It has made me evolve. It has made me grow as a person. I'm on the personal level. They am tina kana bapi giba psychology se. Aduna kedoge haba matanda. Aigidi psychology se aingondasu isadasu apply tawrakanda nungaigiba haraugiba aina penba ama oigiba kaubanina aingondadi sigi se keno tahongibane ba so when you have a little doubt adu tardi noi nangna yengra noina keno tawramdoi se confusion lairamdoi se sigi se career prospects kari lairi kaina ga khalakpa akoigi keno akoi manipur thabak tawragi yes lairoidra kaina ga khalakpa aduga aingonda kitang kai haitare or maybe subject to kitang mark to aina desirable oiba mark to phangak tabani khangde ko but at the end of the day what really matters is nangna tawjariba kaino do subject to nangna pamibra nangna kyam thawai yauna kaino tawjarige adugi matungina honabiyo ba that aduga career prospects na graduation tawrabnina si psychology kaino tawre haraga khatasu nangna psychology tawni haiba laite ba I have seen my friends go psychology tawre hara matungda su they have gone for mass communication journalism da changiba mayam lay natraga MBA tawba mayam ama lay so it's okay it's about there's nothing no hard and fast rule that once if you have pursued psychology in your graduation you will have to do it in your master haiba laite ba aduga akoigi mayam chanaban sa kai do ga ba matamda master se tawre hai tari it's more of kai haini academic oriented oireba koi do your PhD and then you have to apply for like teacher gumba university school college level admaino ina la eba ya matamda but still kai no clinical psychology oira kandana you get to expose at hospital level gumba du gumba dum oire so sugumba sini so just think carefully but I focus should be on clearing your graduation with your the kind of nangna thamjani ba satisfactory mark to adudi yohan bio because that is your immediate goal aina haini isibi long term goal ki budi kainoni but nangna kaidoi no ai oi thoroi dra khala kana sum lai ta di yaroi aduna nang ki short term goal di huju gi semester gi paper ke ka du phasla clear tau ki ge haira kanda khanbi yo adu ha clear tau thoke na khanbi yo adi phajana clear tau thoke means like mark to phajana phang ta di ngon du confidence level do henga idana so adugumba ma haininge first focus on your immediate goals adukanda then you can decide nangwanda MBA chaningbra mass com chaningbra nang atopa subject amada honingbra habeto that's what I want to put forth
that means in short china I say first aina tawriba hozik tawriba do hana focus tawbiko and after that makha tarapado muging on haibane ba yam nungai je chiche aduga mo psychologist oining ba haidi mayam ama leiramani na khanjai ba ko haidi enga sai chiche so haija gre hozik koi manipur sing se chiche so barrier break toraga chatlene hozik atuba angang mayam ama leire student mayam ama su psychologist oining ba dagi tongan ba art ki line da chatling ba mayam hozik science khatam fix toraga leita ba so mayam ama yaure ba ko the psychologist oining ba angang sing chiche na kay advice pipiningi ꯍꯥꯏꯗꯤ ꯀꯔꯤ ꯀꯔꯤ ꯇꯧꯕ ꯃꯊꯧ ꯇꯥꯏ ꯅꯠꯇ꯭ꯔ ꯀꯔꯤ ꯀꯔꯤꯕꯨ ꯍꯣꯠꯅꯒꯗꯒꯦ ꯍꯥꯏꯕꯗꯨ ꯑꯃꯇꯪꯁꯨ ꯍꯥꯏꯕꯤꯌꯨ ꯆꯤꯆꯦ
See, I have kaino tauba psychologist oibase not it's not everybody's cup of tea. Amoromda haitare because you
Okay.
require to have certain characteristics, but that as at a personal level, you need to be very patient. You need to be very have great listening capabilities. You have to have like good analytical nang analysis tawbodu mi se observant yam oiba darkar taiba. So sigumba mayam se yam changi, and you on a very qualitative kaino haitare nang mi do yamna kai haitare khara saungningasu nangonda you have to have this thing of kaini nang nungaitaba sauningbodu shield tawrakanda nangna kamaina client phana nungaitaba nangi personal laitar nang phana nungaitaba laitar, so you have to shield that ko adukana patient natraga client jobo matamdadi nang kai haini yamna you have to be a very in a non judgmental manner nang de dumai toramgani kholamgani kaina yeng natamna yes I'm listening to you ko I understand what you're trying to say kaina sigumba khara quality characteristics khara lairiba. But before that, while seeking for a kai haitara licensed yauba kainogumba clinical psychologist oina tahonbioba haitare ko psychologist haitare MA loiraba mi singchisu aduga right after that clinical psychology gi MPhil clinical psychology yaudata so PhD tautari psychologist adom oidoineba, but MPhil clinical psychologist yaudata they cannot be called as clinical psychologist. Aina haining isiboba counseling kai ka tawbo khotba loi yani, but diagnosis kai ka tawbo dudi yaroiba moina psychologist amanati ko. So that is license out. So so ma'am, if anybody is looking for therapy or if anybody is looking for counseling, please check your therapist. Please check who you're going to get your treatment for. You should be able to clarify your doubts. So karai degi tambira I karai degi license by kholi have do clear talk thokpiyoba. Natatardi kai haitare authentic oiba kaino se hekta oiraktabasu yaubane ba, and then you will never get satisfaction. So sigumba se na angang singdadi thamningi mayam da loin thamningi.
Okay, Chiche. I'm nungaijay. Mathang sidane Chiche. Koi na say haidi psychologist harga loina me branch mayam lay hai se koi kya khangbu oiti lo. We are not much aware of that. Kamba branch lay ko le se kya aware oiti tu na kamba type of psychologist kya lay ke hai badum tang hai bigera.
Okay, but I'm gonna repeat tawbirakera phajana tahade
Types of psychologists say.
karam
Types of psychologists say. Types of psychologists kya lay ke se tang hai bi yagadra.
Oh yes, yes. Hijage. Kamai to have of course we have been talking a lot about clinical psychology. Clinical psychologist haibam laire main waina. Adagi akoigi kaino laire child psychologist ko adum clinical psychology tamak processing se sigi makhada adum child psychologist adum yaugalle. And then we have educational natraga akoigi education room the school room the chatpa haitare ko aduma laire. And then we have sports psychologist. Sports ta tawba hujikti akhoi manipur so national kaino la sports university la so sports ki maram da so akhoi kaino se state se amna kaino tawbanina, so sports psychologist sisu yamna hujikti kana ba kaino mo oire. And then we have forensic psychology na adagi makhal laire ko mayam oina, but main oina khangnari di hujik se clinical psychologist ne educational or psychologist or organizational behavior hai dare ko since na corporate sector sinda thabak tawba mainly HR gumba oina tawe ayamba matamda, so sigumba since na main oina like psychologist ki hai tardi.
Okay, thank you. Kitang hai di mayam lo kitang error man ina kanjay Chiche gi host ki answer du degi. Ado Chiche hai di psychologist at ga clinical psychologist ka khetna is na mu kai oidoino. Clinical psychologist things na tawdo is exactly kai no hai di hoji Chiche na sports ki education ki adagi child gi hape to khai pa mayam types lay re hai grabani na clinical psychologist exactly tawdo is kai no hape tum ta hai biu.
Clinical psychologist na see I quite first of all MPhil in clinical psychology gi degree do yawgada bane ba clinical psychologist haini hai tardi atei aduga aduma laire quite importantly. And then secondly atei sports psychology ꯑꯗꯨꯒ ꯁ꯭ꯄꯣꯔꯠꯁ ꯁꯥꯏꯀꯣꯂꯣꯖꯤ ꯀꯩꯅꯣꯒꯨꯝꯕ ꯍꯥꯏꯔꯀꯥꯟꯗꯅ ꯌꯨꯅꯤꯚꯔꯁꯤꯇꯤ ꯈꯨꯗꯤꯡꯃꯛꯇ ꯁ꯭ꯄꯣꯔꯠꯁ ꯁꯥꯏꯀꯣꯂꯣꯖꯤ ꯍꯥꯞꯇꯦ ꯑꯩꯈꯣꯏ ꯕꯠ ꯋꯤ ꯍꯦቭ ꯂꯥꯏꯛ ꯅꯦꯁꯅꯦꯜ ꯁ꯭ꯄꯣꯔꯠꯁ ꯌꯨꯅꯤꯚꯔꯁꯤꯇꯤ ꯍꯧꯖꯤꯛ ꯀꯩ ꯍꯥꯏꯅꯤ ꯀꯩꯅꯣ ꯁ꯭ꯄꯣꯔꯠꯁ ꯁꯥꯏꯀꯣꯂꯣꯖꯤꯅ ꯍꯥꯡꯉꯕꯅꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯩꯅꯣꯁꯦ currently functioning at ꯀꯩꯅꯣ ꯈꯨꯃꯟ ꯂꯝꯄꯥꯛꯇ ꯂꯩꯕꯅꯤ ꯃꯣꯏꯒꯤ ꯍꯧꯖꯤꯛ functioning because ꯑꯃ constructionꯗꯤ ꯀꯟꯅ ꯇꯧꯔꯤꯕꯅꯤꯅ ꯃꯅꯤꯄꯨꯔꯒꯤꯗꯗꯤ ꯑꯗꯨꯗ ꯂꯩꯌꯦꯅ ꯍꯥꯏꯅꯤꯡꯉꯤ and of course there is aduna adumain tawe aduga kainoda sports psychology oina tamgadabani sports psychology oina further study tawni hai tardi so adu mangaire adu kanda main oina kai haini MA psychology gi kaino se khoi MA applied psychology kaina lairi aduda lorokpa paper lawidina semester da ko aduda khoi forensic ta lawningba natra kaino da lawningba adugi matungina mayamna mogi PhD do aduda further study tawba yaiba adugi basis ta hai tare aduga but forensic kidi aina India da laibase kayadi khangde so what I have come across is that my friends who are interested they usually go abroad forensic kumbagi kaino tawni hai taradi adugum ma laire aduga atayna mo yes sida forensic kina laitabagi ko adu yam interesting du so mupanda yam tam chatkale mo
Okay. Chiche do chiche na sa habi kre ba haidi kaigumba clinical psychologist mo oige hai tardi license lawba adagi kaino register tawba ma darkar taena ada register tawba haisi kamaina tawba da ke kama kaigi through da tawba doino haiba dai krai kai da change have dum so panbiram
register tawse after the completion of your MPhil nang mark pass tawre khole hai tardi you apply to Rehabilitation Council of India moida apply tawrani that that you have passed your MPhil adu certificate sing do thagrakanda they'll issue your license that's how the procedure works adu every 5 years
atopa de kachu
atopa de ten
okay atopa de kachu ko okay thank you very much hojik ai mayam dum vir like anambana career gi matang da clinical psychologist kamaina oige da ge na kai kai tharkar tar ki habagi knowledge layer mani na khanjai atopa makha ta ba lai tar ga su comment section de dum pibiro chiche will be like still very happy to entertain all your comments or any doubts
yeah that's
makha tar ba chiche sai panjak kitang mental health from the kitang pusan jerke ahanbada aina pandoribise haidi nga ikoi dribagi mamangda hose 10 class 10 exam class 12 exam se haidok na greba ko ada student se ko khara mana magi masa gi mark to satisfy oibe yawi khara madi anamana pen da ngak tane ba ada ai si oidre ai pen dre ai satisfy oidre kana depressed chat pa stress leiba ai adu tamning ba aina tamning ba du phangaroi kana yam stress chat pa mayam ma kama cross to jar ebo ko moi gumba student sing sida chichena kai advice bibini ge chiche Chiche, shall I repeat the question again? Tab natraga network kitang problem lai bra chiche. Chiche ki se kitang network problem lai kiba male mayam ngak tangai mina se chiche I think tum ngak lerga mo taksano. Mayam tanja si lawzeraga I think doubts lai basing amukasu haijari comment section da pibiro chiche dum readily entertain tawjahan ge Hi, Chiche. Net kitang nungay ito ba mali ko? Kasi kay di Chiche.
Okay, so
ay na hajar ba do amuka hanjar korana traga yara tra Chiche. Tabi do
amta hangbira ko
Okay. Ay na hose hajar ba do haydi ikoy riba ngarang nahan tani class 12 exam hay to kibasu 10 9 10 11 CBSE Manipur board loy ma hay to kibasi ikoy riba the students sing se masa no hangzari ba marks da satisfy oi ba khara mayawi yawda ba satisfy oi da ba na anam ba ne haijari ba ada moi se stress lay da na aina pamja ba line du tamba phangaroi ai kamain tawni hay amna stress lay da na dagi kai hani masa se emotional stable oi da ba mayam ma su thengnare ba dagi akoi Manipur da even hoi handak ti kya buta de atopo sing the suicide case phaw yauri ba haidi ai se aina expect to ba ai pass to dre ai fail loire ai mark adu yaudre kaina ga tawba mayam yawi sigumba student sing sida chiche na kai advice bibininge adum tang hai piu chiche
the results have been out aduna how grabadi do mayam se loina how gre haining badi hoi my harauba mayam amsu yauramani ko akoigi Facebook page da Instagram da harauba phongdoknaba mayam asu uramani, and there might be students ko who would phone switch off toraga thamba khotpa su mayam amu yauramgani ko phone pick up tawdaba khotaba adi moi keno tawdaba. So harauba mi gi di haraukre nongai ba matang oigre, but exam se thokrabani loikrabani. Exam does not really define you. Marks does not really define you. Sigi sidi kamain haining gaba matamda class 12, 10, 12. Yes, these are important. Major exam ne kaina ka higher kanda mayam says nang hamba major public exam ne ka higher kanda akoy do sudum le rei ko. And I'm sure Chitan Bilada sudum le amgani ko nang class 10 ta do le kaina na hyped up tawdo. But but aina mayam haini sidi 10 bawgi exam is all about akoy achievement test ka we, but 10 gi kaino se exam. So why? Because we're assessing how much the student has accumulated knowledge over the years. Adu oy but 10 gi se aduna duga 12 ki se na it's mainly koi aptitude tawe na kawe ba aptitude test oina kawe ba, because adugi basis ta kai haitara koi se karam mat karai option he na chana gani ha ba deciding factor oy ba. But aseng badi 10 da tawgadam ni 10 du da you get a feel that I say maths yam nungai tre natraga I have more inclination towards arts. I would like to go for commerce. I would like to go for science because I'm so passionate about physics, chemistry, bio. Kind of khalaga tuman choose tong na baneba. But Manipur gi dedi ke to gaba matamda 11 12 se ayambana science chatleba. Why? Because me do yamna science ki flair lagera lairoira. Why? Because after the 12th nangi option do widen up oirakpado for applying for any course haitare nang BSc chakera, BA chakera, NIT thagera, JEE thagera, so toga architecture chakera. So many options get are open. Adumaya trends laiba. But I hining badi kaino haba matamda 10 gi marks to the 11 12 kana na bagi kinu taw yeng na baneba. Hadi nang do science at badap kano taw gadra kana gadra commerce at panakana gadra habagi yeng na baneba seng bagi yeng base. Manipur gi trend na science at pagi like re. But kitoge hanging bada 10 gi exams se haidokre 12 ki so haidokre hujik nangi nang nonda nang na aina kai haitare sigi I desired marks se phangre haira kanda nungai tabu budi nungai ramoy, but aduda sum kapaga laiba ya potre hujik now what now next, what is my next goal habado adudo ina focus taw bana phayeba, because how great khot great, but what you do thoki bado nang assess taw bom changeba where did I go wrong haiba ma khalhoba I do anything hadi I na choigiba su khatang khalloba hadi not blaming the things that were beyond my control. I na kai deshoigi I na class 10 hadi haurakpadagi padraga lo chalambada khatang pabra I ni am laid back oiribra ayam matamda aingonda lakwa ngang singse cases which have usually been coming to me because of exam related moi sayam matamda light hoga sum chatla kanda board exam matamda para kanda katang ri hayeng phangchik ne board exam haira kanda ka paba mayam da yamana oeba adugumba dagi kai haitare masado pakhat mangi danaga phajanaga akoi gi iba ngamamdaba gumba adugumba su yamna yaure ko aduna once exam ama pe subject paper am soigraga mathangi paper du su masada doubt leibu to same lakani haira kanda mon anxiety am no wangi ba khot ki batawe. So what I'm trying to say is how loigre now your aim is next then the mark phajana tawdra haita you can still prove in your 11 and 12 11 de so like thok piganu because no 12 ki kaino se loina dum samna raktori banina like thok piganu 11 de so to 11 ni like pa to I have a concept ama kan chali
promotion exam ne haibagi ang concept ama anambana so past exam ni in pura hekta light thokpa aduga 12 na khangona khotna ba gumba adu mayam su thingna je ko je
adu to wigano haibinge because nang 10 gi kaino do you have a chance to improve yourself in your 11 because nang gi mark kitang improve to rakpa matamda nang the confidence level am dilakani ba adu ne ba important oise aduna but smaina kaino to nang na 12 ta kaino to re higher kanda 70 chatle higher to 60 chatle higher to 90 above chatle high tar so kai high tar that does not really kai haini nang na 70 chatpa angang duna yamna ma se yamna creative writing ne yamna hairam ba yai he might or she might be a 60 chatpa angang duna sports ta yam tina pharam ba yai guitar kong ba yam hairam ba yai magi boba ko, and he might have like great other atop abilities atop su layram ba yai ba. So marks to katana nang 90 yodre 80 yodre haira kanda kemta kai haini mongol sotha ningai late. You can options are still available, options are still there for you to to pursue your do your graduation haining eba aduda nangonda hogiba exam du sum sotharaga laibadu di to haningte next ka kai lakani habase sida wakhal du khallaga ai ke to bayage, let me work towards my future goals and adumaina khalaning eba haugreba.
Additional and not the finale na do we have much more in our life I bedo hiding bani bachi chen hai si mai ama ba ko na bayari makha ta mai ama lai hai bedo yam nungai chi hoi career ke line da kitang hai na ringai chi chi ai di hoi yam di vast or ni ko ai hai se the question se yam maram di kitang chaw do kitang ten up na pan biram akoi gi akoi gai se ai sungare aishu isa khangjarakte ba hai aisi tawgraga master se sit layraga mayam lay kai tawba yai se khangjarde student mayam amasu khangde aina science stream se lawgraga kai tawgadagi art stream se lawgraga na kai tawgraga gi habase sigi matang da chichi na layba idea na traga knowledge kitang panbiram ba yagadra.
Okay, sige say important wa kaino ne kuki career related kaino sing se aina dinga sa hire dana wa hadi 10 gi matung ina ko se aptitude hai tari kaino aba matamda ability to learn, tendency to learn adu isagi pithok sarak pa khara yauri ba mayam somebody might be really good with kai hai tare verbal kaino ability gu mayam phasana leram gani language use to bagi kaino, and some might be good in like really kai hai tare ko gi numerical ability sigumba se ma gumba se kaino to bu matam hayeng mana engineering gumba computer gumba tauba sugumba sna hena chana ba. So akoi gi adagi mechanical ability kaina ga hai tarde khoi gi khud semba khotpa masagi haiba gumba sugumba sina mechanical engineering adu gumba sida chakki bana phagani khotkani haiba malai riba. So isagi kaino haiba isagi capability isagi aptitude to khangdana chakki basne ba hayeng yamna wari se yam bamtamda. So agi isagi capabilities is ne sine na kanga I am really good with my writing skills. I'm really good with my 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 vocalization ni kang de na traga spoken words ni hai tari. You go for journalism, you go for teaching, education sigum badum chat pa yari ba arts ki dani ko hire sa, and then science ki dadi ko ai na am finding by if somebody is like kai hai tar chemistry physics bio they am tina passionate oi tar din then you go for it na ta tam de adi hire ga bsc pag tam base yamna okay satra du yamna wagan bangam de aba na ta bangam ding ngam ba but yamna wagan ba ma adum oi ba. So ai na hanging basi ka to ga ba matam da yari makai kaino tawbiyo noi isagi capability kain hai aina ai se kari ai gi area se kai strong oige habase hana phazna tang assess torga yengbiyo aduga engineering say if somebody is like good in maths please go for engineering just because I is man engineering taw dia de habagi trade the chat pigano. If you like maths, go for it. Same goes with physics, ni hange, chemistry ni hange. And then there's something called special ability kind labor. When a pot seeing matam da koigi 3-dimensional figures, me di kara I di kara watch ko I some kind of matam da. Imagine the before you take a photograph, you have to imagine AC settings at orga chana ni kona ni kana director naga tauba kotpa like that. Sigum basing se. So sigum basing na the architecture ni hange, fashion designing the ni hange, natural photography gumba the tauba since yamna kana ba weba. So make sure that where your skills lies, make sure that nang karida strong oike habato then only you go for it. Sinain haining ba.
Yam nungai ji chiche hoi aduga chiche ga hoje ai ga chathai conversation sidagi mayam hena khangning ba mayam am yarong gani ba ko da chiche ga consult tauge hai taradi kamaina tauga ge habito samlap nam tang panbira mu chiche.
Oh yes, anybody can yes, anybody can contact me. A phone number dum provide to biba dum yagani ko. I dum phone number dum provide to zarake. Then who would want to come for counseling or who want to consult me, they can just they are like welcome to me. Phone da dum to wirakanda, we can do via phone. Ni kangge laki hai tar su adum dum we can set up a session appointment am fixed on nargal when available over timing da dumine to su yai.
Take your phone number. Yeah, that's the phone number. So have you so that all can be aware of that.
Okay, I give phone number. Say, see that hazard agi koi Aduga, Chitan Bala, I can see some questions. So can I take it up? Should I take it up?
Chichi, conversation se hedi logi do kitang khara hedi kitang khamning ba khara kitang lai ri chichi adu
Oh, okay,
loraga
okay.
dum moi myam gi
Yeah, yeah,
comment loina entertain taw se na khanjai chichi adu na nungai do
yeah, yeah.
male na ta tari
Ho,
mix up
ho.
taw khrani bu ko
Yes, yes, sure, sure,
hoi
sure.
chichi
Uh,
waro ga de ko chichi
what?
keno
Okay,
tawre
what? Okay. Yes, yes. So,
okay
uh,
ꯃꯊꯪꯁꯤꯅꯅꯦ ꯍꯥꯏꯗꯤ ꯑꯩꯈꯣꯏꯁꯦ ꯍꯧꯖꯤꯛ ꯄꯦꯟꯗꯦꯃꯤꯛꯅꯦꯅ ꯃꯌꯥꯝꯁꯦ ꯂꯣꯏ ꯂꯥꯏꯊꯣꯛꯅꯔꯒ ꯂꯩꯅꯔꯦꯕ ꯂꯣꯏ ꯂꯩꯔꯦ ꯑꯅꯝꯕꯅ ꯁꯥꯇ꯭ꯔ
yes,
ꯀꯣꯂꯦꯖ ꯁ꯭ꯇꯨꯗꯦꯟ
yes.
ꯏꯚꯟ ꯌꯨꯅꯤꯚꯔꯁꯤꯇꯤ ꯁ꯭ꯇꯨꯗꯦꯟ ꯁ꯭ꯀꯨꯜ ꯁ꯭ꯇꯨꯗꯦꯟ ꯂꯣꯏꯅꯃꯛ ꯂꯥꯏꯊꯣꯛꯑꯒ ꯂꯩꯔꯦꯕ ꯑꯩꯈꯣꯏ ꯃꯌꯥꯝꯁꯦ ꯑꯗꯒꯤ ꯑꯃꯨꯛ ꯍꯥꯏꯗꯤ ꯑꯦꯛꯖꯥꯝ ꯐꯥꯏꯅꯦꯜ ꯌꯔ ꯂꯩꯔꯤꯕ ꯍꯦꯟꯅ ꯄꯥꯈꯠꯂꯤꯁꯦ ꯐꯥꯏꯅꯦꯜ ꯌꯔ ꯑꯦꯛꯖꯥꯝ ꯊꯥꯔꯤꯕ ꯃꯌꯥꯝ ꯀꯥꯔꯤꯕ ꯃꯌꯥꯝꯁꯤꯅꯦꯕ ꯑꯗꯣ ꯃꯣꯏ ꯃꯌꯥꯝꯗ ꯑꯟꯁꯤꯌꯣꯔ ꯑꯣꯏꯕ ꯑꯁꯤꯗꯒꯤ ꯑꯃꯨꯛ ꯑꯣꯒꯁꯇ ꯑꯃꯨꯛ ꯇꯧꯅꯤ ꯍꯥꯏ ꯖꯨꯂꯥꯏꯗ ꯑꯃꯨꯛ ꯇꯧꯅꯤ ꯍꯥꯏ ꯁꯦꯞꯇꯦꯝꯕꯔꯗ ꯑꯃꯨꯛ ꯇꯧꯅꯤ ꯍꯥꯏ ꯑꯟꯁꯔꯇꯟ ꯗꯦꯠꯁ ꯃꯌꯥꯝ ꯑꯃ ꯂꯩꯔꯦꯕ ꯑꯗ ꯀꯟꯐ꯭ꯌꯨꯖꯟ ꯃꯌꯥꯝ ꯑꯃ ꯊꯣꯛꯑꯦ ꯃꯣꯏꯈꯩꯗꯗꯤ ꯁꯤꯒꯨꯝꯕ ꯁ꯭ꯇꯨꯗꯦꯟꯠꯁꯤꯡ ꯊꯥꯏꯅ ꯊꯦꯡꯅꯔꯤꯕ ꯀꯣꯂꯦꯖ ꯁ꯭ꯇꯨꯗꯦꯟꯠꯁꯤꯡ ꯑꯣꯔ ꯏꯚꯟ ꯌꯨꯅꯤꯚꯔꯁꯤꯇꯤ ꯁ꯭ꯇꯨꯗꯦꯟꯠꯁꯤꯡꯗꯗꯤ ꯀꯩ ꯑꯦꯗꯚꯥꯏꯁ ꯄꯤꯕꯤꯅꯤꯡꯉꯤ ꯆꯤꯆꯦ
Okay, the exams will be held anyhow. September
By hook or by crook.
yeah, the exams will be held anyhow. University exam you had a notification pada September that's why the makita ugani and UGC na keno mogi protocol khara tawrakanda so thokani haibagi shu dum thogle guidelines ko. So that will be held no matter what or any competitive exam ni hire so keno gi haigira nit UG gi haigira natraga UPSC CBS any competitive banking exam ni haigira ko thokdog leirabane ba sigi sidi ko. But important thing is how you make out of this time. Karigumba paikha se hoi kitang lang tak na badi thuan gani ko paikha se sum postpone taw leire haiba for example nit UG thaga da mangang sing se natraga 12 thaga da 10 thaga da exam sing se kamai na bu taw toino hadi classes so online ni kaino tawini kaina hire kanda moida pakhatpa but amorom the CBSE bhawba 30% syllabus cut down tawre so Manipur board ki su dum tawra ani
Counseling
nei tawre
exam so
yeah
tawgre
uh,
that
oh
15 point
tawre
notice thokre na chiche
okay okay
council ki
so
so 10 gi
aduna
dinate board ki nataba
oh okay okay so the minor council gi is mind to work hot patawre though anyhow the exam will be held but nang na matam do lahobado you are getting a hell lot of time amorom dedi to prepare well amorom da nagi matam se lahoraga nang na gray areas myam nang na khangning badu he na practice tawbagi matam amuk phangi bane ba which you won't get normally atopa matam dadi so adugi matam tanda se lahora kanda please make the most of it because I know that lockdown lai re am nungai re mayam se ko pura holiday mo to jiti khara thongna re ko online classes tawrak pani khangde khot pani khangde but competitive exam thaga dari ba anga 10 12 thaga dari ba dagi atopa competitive exam thaga do budadi nangi the exam will be held anyhow so please nang matam se lahora kanda work on your gray area set up a schedule ko nangi nungai zaba nangi nungai zaba physical activity tawgera khotgera dum tawiu but make sure that you have a systematic way of koi study timing ama khaidok piu aduga study se tawa matamda nangi study matam mapham duga nangi bed space duga mana hanganu ba ya matamda because when you are studying from the bed space you have a tendency to be a little lazy or lethargic or kaniba so make sure that you have separate so make sure that you have
mayam
separate
common tawna mistake ne na khanjai si se amna hadi phamung da paraga nungai mayam tawna ba common mistake ne
hoi adu phamung da paraga nungai ba haise kadoge da kay ani at least phamung da pare hire su phamung da bung natra tar su phak natraga mat ama thara kan huji ki sar ba kobuna dum adu maina tawgera kitang thabiyo change tawbiyo because of kay haita sum kaino the phone par phamung da kaino par phamung da dum oidana adna kitang study space ka kaino space su kitang demarcate tawbiyo du tari kitang kaino oidana kitang kaino oir edana kitang active ohele hiding by wanida so adu thamningi make out the best of it because he se hana so talk deba you are getting so much of time this is what I have been telling my clients who have come to me amarom dadi so make the most of your timing it's a great way to practice aduga noi matam yam noi revision ta hodre habito and aina hiding ba maga ko yamna mistakes that usually do hai se kaino haba matam angang sing se moina ne ko they usually defy khangaba pochibu kaina gane ko yamna ne yenga gane yamna chatle ba yam matam da side khangabani na so what they do is pa giba poto khangdi khangaga mamutana question la ko matam da mamutana khangbra su natagum taw ko khangum su taw so sugum masi am taw ba now that is what we call is revision le hauda base revision high tardi the port ki kaino do just to pasana khangau se sigi se common mistakes among the children that I face ko the 12 exam tha bani khang de 10 natra competitive exam tha ba ngang sing so I usually assess to bo matam da moi se study style kitang khena ba lai ba they usually kai hai tare ai di khanga bani ha confident ora chakra kanda example da la ku matam da di khanga ba po to common mistakes yam tawe so make sure that you revise but before revising make sure that you understand you digest the concept very clearly adui tari nang warning I will like is ni se ap thamdi gi se
Okay, and doubt my mama clear to mani na khanjai chiche yan sa to dagi hoi hojik sta bu khoi larik dagi mu kitang na thaira ga chiche amu kitang lak chage haidi hojik se mental health problem se yamna laire ba ko ado thaina like years ago chahi khara gi mamang da lairam baga hojik sum no ni hingal le na chiche consider to vibra mental health problem se natraga atopa perspective lai vibra chiche ki
okay let me clarify I mental health problem ga mental health illness ka se I clarify to jage what we really mean by mental health is that koi mental health haidi kaino haba matam da motivation se tang handharak ba confidence down orak ba san isada thaza ba self esteem gum se down chalak pasibu mental health problem ka weba and when we talk about illness hai tardi khoi gi disorder of the chat kreba adu ki illness tuna ai ki nungti gi functioning da kai rak pa hai tare normal functioning hai tardi we are not able to carry out our daily activities like pa ba ngamak ta ba tum ba cha ba tarak ta ba mayam ka puning ta ba haining da ba phau ba isa se guilty feel adum tau ba pakhat pa charang na ba phau ba ai ukarina raza no ke do raza no na khajal laga laiba so any disorder depression anxiety nat adumai tau ba na ba
mental illness
mental health problem can be take from students in the yam matam da khoina urisina akhoi gi marks se yamna phangak kan daga kai hai suppose 10 da position holder oiren khala se 11 kabus due to strict marking or something if the person is getting like around 60-70 khaladi adusu pura angang do kaino tawba mental health la eba sok la eba ai se hydra la khotla zala kaina kana dumai doubtful oirak pado aduga akoi youth sing da yamna uba sing se akoi gi kai haitar young adolescence plus young adulthood ki stage da uba sing se akoi na kai uge haba matam da relationship issues na maram oirakanda su yamna thoan ba akoi gi mental health ta kai ba se yam tawi ko relationship because breakup kumba kena tawba khotba thainagibada phasana kop tawba ngamhawdaba singse sigi so that is also one factor that I want to put across haitar
okay
aduga mental health ki kaino ai am ta hana dagi haitare ko leiram daba natte bahana se hujikna muken hengala eba there are so many factors ko hujikna khamba hele isna people are coming out of their closet amarom dadi hana di stigma hujikula ko stigma said that if you're consulting or going for a counseling is still considered a taboo a stigma but what was happening is that koi hujikti amu kamain to ga haba matamda mayam se knowledge khelak pagi ni khangde adagi koi awareness lak padagi psychology na traga counseling darkar tare have se naharol sing se yamna khangba hore eba aduna they are coming on their own adune aduga parents sing su angang sing se kai haitare dum angang se counseling to biyo nga ki smile lare kano to bagi matang like paw yadre khotre phone yam use tore khole dupi na ha kaina bagi matang dani haira usually they come for it and which is a good thing amarom dani so hujikna di amuka we see a lot of cases coming up haitare and but amarom da hujikina can oire dana ko but national mental health survey to bo matam dane akoi gi overall mental health issue lai bese illness like base Manipur gi sina moves around 19% laiba national overall India gi na move 13 something percentage laiba so Manipur gi sho den yami ba more than the national average so sima khara thamning it is still there but mayam se am open way basic tang di watli na di lowi but they are coming up high tar awareness me am sandok pagi ni khang de masa khangak pa kholak pa educate exposure le rak pa de gi ne nai lawjai gumba me am se
okay adui tardi thaina su leiram daba natte ba leirami adui tar su hojing na mu open orak padagi khara hena guessing se register helak padena khalle ba boche hoi aduga mu hojiki okay duga hojik na mu technological advancement me ama leire adagi social media si su technological advancement ne consider tawse moi me am sina khoi hojiki mental illness na traga mental health problems sing sida hengat hanbagi kainoma room ama piyena chiche consider tawbibra chiche.
Yes, of course. There's always pros and cons. See, phone, social media, and everything. These are all technology. Technology से कोई है तारे चौखट के खतने से नहीं बा. And कोई technology से मैं इसलिए मैं आमसे कोई से कहीं है तारे to कहीं है नहीं aid us to aid humans को कोई है ना like talk ना बा कोई ने नुआई ना बने बा. But what we see is that कोई से phone की के नो से हम न लेना रहे. कोई का अदुगा तार सो अदुगा there are some क्या हम खान दबुसु ले बा. Social media use to work but social media say kai haitare ka na use to work pasu dum yauri some in a good way, some in a bad way, some hadi mood kanungai traganda kai haitare social media se use to work kanda yamna negative foi ba kai ventilation gi macha amasu oi adu amor of the phagi basu yawe mi se ko adu ga yamna asoi basu dum uba yawe ba kay ako'y kinu uwa matamda amazing na ako'y they have a tendency to compare their life with other social media dadi but may am din hining is the social media the utli sing se it's only the phazaba phaba to khatane ba nobody would like to watch their never aduna madi si chatre madi si shetle madi si koi grehe habdo so please don't get intimidated. There are so many facets to life. Mi ama mi nungai taba like taba yaw pote. Family da problem thok taba like yaw pote. Everybody is having their own set of problems. Adu bukai hai tare. Koi na kamay na kino to yam tini intimidated. Asmadi am nungai kre madi kino to kre kaya na kanda yam intimidated. Oy baphaw basing tang power to kitang khanda batam se mi gi kino ni life ni na hining e udlising se nungai ba phaw khatani ay yung khanare ay nungai tre habli kara the higher than only some people would want to ventilate. So the social media ki se kana basu main like because MitSna say this is on a social media platform and so many people are getting benefited because of your initiative natra so this is a good thing. So akoy na kamay na use toge hai bada lay re pa social media se ay na kamay use toge habda lay re so do ne kaino ne makhal ne facets se pros and cons se animak tum lay ni do ina khangaga chatpa aina hairaga chatpa habaduni because koi hujitagi khangor because social media de kari de koi hengat ke advance or ke khatane ba lak tori bise so you should be able to go in with the trend but not get affected but akoy na u base ke doge da game gi disorder natraga excessive internet addiction gumba se koina uiye behavioral addiction oina di chatpa hai tare koi se kai doga ba matam addiction se kai hai tare brain gi koi gi you gi addiction alcohol gi addiction oi bas maina hai tare same thing gaming addiction si su koi gi latest oina koi se yes in fact drug administered tawbada so anti craving drug administered tawba however because of gaming addiction yes PUBG chanari ba kholi ba mayam sipo ba tum bacha ba khangdan hack the game du dunya da kano toraga leibase so that is one aspect that I want to highlight adumadi thamninge aina ngamaga chalhansi technology bu so social media bu so aina hairaga ngamaga wakal khandaraga chatsi adu tari kem sokningai leite aduga aina yam thini henjanna lokhaluraba adu di shoira esineba
Okay, the target is chain high being say social media or advanced technology advancement na akoy the social say me to the depend tawre habane ba haidi aina khandokpa ngamba haidi aina sigi matang sagi lore barrier thamba adai filter tawba ngamba capacity the lady habane ko chain high being say
yes the mind over
yam nungai chiche aisu khangba yaba chiche dagi yam mayama ma khangore makha da aina khagzani ise hoi matam di yamna limited way do tar su question amani katanga chiche ga adum discuss to mina house ay yar tension jana bo khotna chage haidi akoy manipur akoy society se hoi yamna kai hani yamna yam small society ne ba dagi mi wangang na ba kai kana yamna than society aduna mi sing se masa gi mental problem kitang depression ta bu hire su na trake no kitang nungai ta ba moi tar su sideline ta we na khanjai ba ko ina de ado chiche na su mai na khanbi bra problem sing se sideline ta raga thame na khanbi bra chiche na su
problem sideline ta ba habiti akhoi gi personal
mental problems sing se haidi adum kai special to da kashu measure kaino natte khote mayama adagi mu doctor consult to budang su hai boiro ikai na lotsin bagumba adagi kitang nungai jadam doctor koi counseling kitang to thoga di phai na dum khangnar le wa pham ne ba doi tars as macha ni da khra lerga it will pass away and smile light thok pa se dum to we na chiche na so consider to be recommend to
Yes, on see, it depends on the individual. So I hining it. Me kara se see akoy se nungai
Okay.
ta bade dum akoy loin mak face tawna doi ni ko. I should face tawra e. Everyone faces that. Adu tar so ay naga maina kop tawgi de haiba du da laire ba. Kop tawgi ke haiba du da laire ay yamna aina aigi control to be abo factor do da suppose aigi social support thi bani khang de ko aigi friends ka kai haido hygiene tawra kanda phaba phagiba natra kanda aina atopa mo way ama thiraga spiritual kaino rom da chala ganda phagiba depend tawe but then aigi sum kai hai tare mi se kai hai ni mi se sum henjala kanda khaga nungaitaba se isai tanjing to bangam redu kem kai de ba sum henjala kanda ai se tha ani net tha ama sum hazal lakpa oi tari then it's high time that you consult kaino na haining don't go don't okay haini ithal na dum ngamni habigi to kano to ganu yare makai consult to ki kaino dum dum I thamni and haire ko and see whatever you will be sharing to a therapist to me noigi poching do everything will be private and confidential. I will not be talking about it to anyone sineba in haining is so sigumbagi kaino ma trust factor amasu leiba ma changi mayam das ko noina personal oiba khotpa nungaitaba mayam dune ba khoi delirak tori se then we will be able to address karino karano kai nungaitino kamaina phajana kop toba tamsige the way you were coping was not very kahani effective aduna smine tausi khochi nang na khalli budimak chumba nate kaina kan hairaga magi problem di matungina formulate tawraga chatori baneba khoi ki kaino se so that is one thing that I want to put across if how much you have been okay hai nangi normal life ta kyam effect aurage kyam sang effect aurage habado and ngamaktre hai tari please come up we are all there to help you in any way possible adu gumbado adum keno to honinge mayam da sineba
Okay, Chichi. The Smile Namdha Sina Mo, society Sida, societal case Kakamam Hengala Pasiga so relate O in a Kandi Brazicha.
Yes, aduni hai se. Ako'y recent example Manipur suicide case amusu thoki ko. Ako'y may amna COVID positive or amaga recovered tawra kan then yum the like
Oh,
beta.
Amama.
People were blaming for yes, people were blaming for stigma community level da lekaida do da high bako. But we never know because we see that ko to pa problems layam gani ba ma se. Like we were like talking about asma kamai angang sila exam hasana tamini kaina ga hiraga she was so educated then how come she committed suicide in a high IQ is not related to suicide. No correlation at all, please, okay? So, ay haining badi kayo haba matamda, mana kamay na magi emotional problem gumba do kara magi handagi leram gani ba. Adu do howda ba ni khangde man haidok ta ba ni khangde adu tawrak pa dagi ma se hope amount ta lerak ta ba oirak pa. Adu na ne ba mana tawr ido suicide tawr ise. Hope u da ba se. Na ne ba. So, adu na depression se and depression in most of the suicide cases, 60% of the suicide cases, ayamba matamda, kaino oiba depression disorder dagi so ayamba oigaleba. Even the case of Sushant Singh Rajput ko, siguro se oiba. Adi mana masagi problem to deal to banga maktaba hai tare ko and depression duna mga nakanam ta lead ba ko taba he was not kind of seeking help and masana sum internalize of salaga lai gi baduna he na monda aggravated oirakpa hai tare ko aduna ma mind to ki ba magi problem me am do see the problem la kanu hai ba khoi na thing ba ya pote ba that is something that are beyond our control right but akhoi problem la tar so aina kamai tauge ai problem kamaina aigi life ki problem se kamai solve tau na bo khona ge ai kamaina emotional wise ni khangdi ka ai kana consult tawraga phage kaina kanaga sumaina khatang tathok tasin tau na bani khangge tawbi patardi phagadaba so yes
Okay, kitang
I
open
don't
na
know
po ba? Sideline to biroida ba? Minimize to biroida ba neba?
sigumbasinse mayamda thamninge sine in hygienics
Okay. Yam nungaijay si Che mayam kaino tawraman. Aroiba question natraga aroiba ina si Che dagi khangningi se si Che hoi matam se so yamna kaino toksale doi tar aroiba ina si Che simtanga haibiramo. Haidi akoi mi sing se physical health yam important pi ba. Kitang narakpaga doctor hekta ba chatli. Ado mental health de so koi emphasis pi na ba priority pi na ba sige suggestion kitanga haibiramo si Che.
There's no health without mental health. That is
Okay.
what I want to say. There's no health without mental
Yam
health. Why?
important thing neba.
That's important. Oh, ꯀꯃꯥꯏꯅ ꯇꯧꯒꯦ ꯍꯥꯏꯕ ꯃꯇꯝꯗ ꯑꯩꯈꯣꯏꯅ ꯀꯩꯅꯣꯁꯦ ꯃꯦꯟꯇꯦꯜ ꯍꯦꯜꯊꯁꯦ ꯂꯝꯂꯥꯏ ꯂꯧꯊꯣꯛ ꯕꯤꯀꯣꯁ ꯑꯩꯈꯣꯏꯒꯤ ꯊꯕꯛꯁꯤꯡꯁꯦ एवरीथिंगꯁꯦ ꯑꯩ ꯀꯩꯅꯣꯝ ꯇꯧꯅꯤꯡꯉꯦ ꯑꯩ ꯀꯩꯅꯣꯝ ꯄꯥꯝꯃꯦ ꯑꯩ ꯁꯤ ꯊꯕꯛ ꯁꯨꯒꯦ ꯋꯥꯠ ꯑꯦꯚꯔ ꯑꯥꯏ ꯗꯤसाꯏड ꯇꯨ ꯗꯨ ꯏट्स ऑल अबाउट योर ब्रेन ꯉꯥꯛꯇꯅꯦꯕ ꯇꯧꯔꯤꯕ ꯊꯕꯛꯁꯤꯡꯁꯦ ꯅꯠꯇ꯭ꯔꯥ ꯑꯩ ꯐꯖꯅ ꯆꯥꯕ ꯈꯣꯠꯄ ꯍꯥꯏꯅ ꯗꯤꯁꯥꯏड ꯇꯧꯔꯤꯁꯤꯁꯨ ꯀꯅꯥꯅ ꯇꯧꯒꯦ ꯕ꯭ꯔꯦꯟꯅꯦꯕ ꯁꯣ इट्स ऑल अबाउट योर दी ꯑꯩꯒꯤ mental processes ꯇꯨꯅꯦꯕ that is in the work ko aduna what I want to put across what I want to put mayam the high say it's very important to take care of mental health not just because any mayam say yam thina keno oi have gi wa nate akoi na kitang keno tor if you feel that you are very stressed out talk to somebody or you try to analyze what's making me stressed out how am I going to deal with this situation kind of khandharaga lai daine sumaina kitang khandharaga like thamninge aduga khoi covid 19 gi matang da soi haipet paloge ko problem में देखो it is very important that you stay positive mental की health सिनेबा को because नंग positive लगी कोई नंग फरक पड़ी मतंग फरक पसु recover तो बसिसो हेलक्टोरी बनेबा so that is one example of taking care of your mental health सी ओइतारी हक्चांग physical health सु अदम नंग immunity strong ओइरकनीबा अयाम्बा मतमदा and mental
Haidi
health
mentally strong oitardi physical strong oirakaniba.
yes कमाइन तौगे है फिजिकली स्ट्रॉन्ग है साजेन तौदना कोई फिजिकल एक्टिविटी का केम तौदबदो नत्ते को फिजिकल एक्टिविटी इज वेरी वेरी
Ho ho.
इंपॉर्टेंट अदुम हाइनिंगे so it's all about your mental processes which are at work so please nang nungaite khote charang nei hai tardi please try to seek help from your near and dear ones and moina kitang moida haibda kitang khautak chare nungaite hai ta so please come up to me or any clinical psychologist akhoi adum yamna willing hoy aduna noi help tawbai da makta simayamda ai thamjaninge
Now nungai chiche thank you very much chiche ga hoji aiga sana kriba conversation duna mayam mental health ki related pu oiro or career ki line ki related or bu oiro kitan enlighten torangani na thajai chiche ado numbers aina ngasai su haije ke bedone pung se yamna haidi kuina sang ten matam si su koida yamna kaino leitabani na comment ti mayam ama la ina khangche do kitan akoina relevant oi hai ba kai chiche ga chiche ne entertain tawrse
okay
ahamba comment se Mana Harisi, can any BSc nursing graduate apply for MA or MSc in clinical psychology? Please reply in English.
oh
Question
yeah
se
sure
Bhaskar Deka dahini.
Bhaskar you can apply. Yes. Well, it depends on a university where you're applying, where you intending to apply. All right. See, there will be. So first, if you want to apply for Delhi University, please check because Delhi University has some criteria for the subject background. So it depends. So for Delhi University, as far as I remember, you can apply if you are from education background, then you can apply, or from political science, or there are some criteria like that. So please check the university for their criterias. Otherwise, there's no issue. Even if you have pursued BSc in any other subject or BA honors in any other subject, you can still apply for MA in psychology. So it depends on the university. So please check the university that you want to apply for. But make sure that you study the basics of psychology because all the universities will go through. You have to go through an entrance exam for sure. So make sure you practice the basics of psychology and the questions. I'm sure it'll be like questions you can. I'm sure it will be available over the internet. So please make sure that's what I want to say. Like make sure that you are good with the basics of psychology. That will help. It's okay. Even if you have done from any other subject, BSc nursing or any other, you can still apply for psychology.
I hope Bhaskar, your doubt has been clear. The next question is, are clinical psychologists and therapists the same? Clinical
Uh,
psychologist ka therapist ka se manabra hai na question nama mukla chiche.
yes. The other name of clinical psychologist is therapist. So it's the same.
Okay. And the next question is, che maitegi oiba might be lai tongbagi na tawbase psychological that related oibra and che gi siga matang da kari wakhatlo che sigi matang da kari wakhalon amta haibiyo. Hai.
Like oi, yeah, I'm thinking chown related oi. ꯑꯩꯈꯣꯏꯒꯤ ꯆꯠꯅꯕꯤ ꯑꯣꯏꯅꯀꯣ ꯊꯥꯏꯅ ꯑꯩꯈꯣꯏ ꯃꯥꯏꯕꯤꯁꯤꯅ ꯑꯩꯈꯣꯏꯒꯤ we call it shamans we call it shaman ꯀꯣ ꯑꯩꯈꯣꯏꯒꯤ traditional healing practices ꯁꯤꯗꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯥꯏꯕꯤ ꯉꯥꯛꯇ ꯗꯣꯛꯇꯔ ꯂꯩꯔꯝꯗ꯭ꯔꯤꯉꯩꯗ ꯃꯥꯏꯕꯤ ꯃꯥꯏꯕ ꯉꯥꯛꯇꯅ ꯇꯧꯔꯛꯏꯅꯦꯕ ꯃꯣꯏꯒꯤ relevance ꯁꯦ ꯑꯩꯈꯣꯏ ꯍꯧꯖꯤꯛꯀꯤ ꯄꯨꯟꯁꯤꯗꯁꯨ ꯑꯗꯨꯝ ꯂꯩꯔꯤꯕ ꯂꯩꯇꯦ ꯍꯥꯏꯕ ꯅꯠꯇꯦ ꯊꯥꯖꯕ ꯌꯥꯎꯕ ꯑꯣꯏꯇꯥꯔꯗꯤ ꯑꯗꯨꯝ ꯊꯥꯖꯕ ꯃꯤꯁꯨ ꯑꯗꯨꯝ ꯂꯩ and ꯑꯩ ꯀꯩꯝꯇ ꯑꯗꯨꯗ ꯊꯥꯖꯔꯨꯅꯨ ꯈꯣꯠꯂꯨꯅꯨ ꯑꯩ ꯀꯩꯁꯨꯝꯇ ꯍꯥꯏꯖꯅꯤꯡꯗꯦ but I want you to get some facts checked as well ꯃꯥꯏꯕꯤ ꯇꯣꯡꯕ ꯈꯣꯠꯄ ꯇꯧꯕꯁꯦ ꯑꯌꯥꯝꯕ ꯃꯇꯝꯗ ꯑꯩꯈꯣꯏꯅ ꯎꯕ ꯃꯇꯝꯗ ꯃꯤꯒꯤ ꯄꯔꯁꯣꯅꯦꯂꯤꯇꯤꯗꯣ ꯀꯩꯒꯨꯝꯕ ꯈꯤꯇꯪ ꯂꯩꯗꯥꯏꯅꯦ ꯁ꯭ꯇ꯭ꯔꯦꯁ ꯍꯦꯟꯗꯜ ꯇꯧꯕ ꯉꯝꯗꯕ ꯄꯨꯟꯁꯤꯗ ꯑꯋꯥꯕ ꯆꯩꯅꯥ ꯂꯥꯛꯄꯁꯤꯡꯁꯦ ꯈꯤꯇꯪ ꯁ꯭ꯇ꯭ꯔꯦꯁ ꯍꯦꯟꯗꯜ ꯇꯧꯕ ꯉꯝꯒꯟꯗꯕ ꯑꯣꯏꯒꯜꯂꯦꯕ so ꯂꯥꯏ ꯇꯣꯡꯕꯒꯤ ꯑꯗꯨꯃꯥꯏꯅ ꯍꯦꯛꯇ ꯎꯠꯂꯛꯄ ꯁꯤꯝꯇꯝꯁꯦ ꯑꯩꯈꯣꯏ ꯇꯧꯔꯛꯑꯦꯕ ꯈꯤꯇꯪ ꯑꯋꯥꯕ ꯅꯨꯡꯉꯥꯏꯇꯕ ꯋꯥꯔꯤꯒꯨꯝꯕ ꯅꯨꯡꯉꯥꯏꯇꯕꯒꯨꯝꯕ ꯀꯩ ꯍꯥꯏꯅꯤ ꯊꯦꯡꯅꯕ ꯃꯇꯝꯗ ꯃꯣꯏꯁꯦ ꯃꯥꯏꯕꯤꯒꯤ ꯁꯤꯝꯇꯝꯁ ꯂꯥꯏ ꯇꯣꯡꯕꯒꯤ ꯑꯗꯨꯃꯥꯏꯅ ꯑꯩꯈꯣꯏ ꯎꯔꯛꯄꯁꯦ ꯑꯗꯨꯝ ꯎꯏꯌꯦꯕ ꯃꯦꯅꯤꯐꯦꯁ ꯇꯧꯔꯛꯄ ꯍꯥꯏꯇꯥꯔꯦ and mind you it's not intentionally it's manifest
even
it just
students
manifests
sing ozana kitang chairuraga amaina tongakpagumba se aisu come across tawjagre
yeah so ayamba matamda life stressors se deal tawbase ngamdaba haitare moje kitang wana thopa ayamba da adugumba case ne ayamba oiba so akoina maibigi angang sing lakpa mayam se akoi de dum hai that laigi edu katkadaba khotkadaba loina rituals sing do loina tawbiu tawsu tawbigadabani somi thajaba makham da tawrinena but aduda dum chalhalakan angang se yam thina kai haitare as if something kai haini kaino to maso normal oina life to lainena bai damak to focus to haleba koina so we put up like coping strategy what pay neba punsi da awaba chaina khang base mayok na ba haita ba gine na so we try to build in more coping strategies moi coping strategies so tambina bo in khone ba khoina adumaina tawe so it's very related to psychological state of mind ga
mathang ki comment sina clinical psychology nattaba atopa psychology hojiki society sida yamna demand oibase karamba oidoino hai
demand lay base loinamak lay ko psychologist ai clinical psychologist ko haraga aina sila katang emphasis tawba nate just aina sigi sila kamthalubagi aina sigi matangda khangbo haijabani relevant to psychologist in any amakoi banate but ai field da okay haini kana ba pibado adune ba maru oirisidi atopa psychologist society da loina kana ba phangi aduga khwai maru oina akoi gi yone clinical psychology mak tarokta tarsu psychologist mak oire hai tarsu MA PhD loiraga su academician oina tauri adu kana atopa akoi gi kai hai tare women helpline dani khangde child welfare committee dani khangde they are an integral part because human behavior se study tawbagi se psychology tamba clinical psychology gi na just kemta na ke ahen ba kai no ma yaurisina moigi mental illness se deal tawbagi matang da hena takpagi wane ba so that is one huge kai any difference like by one but any psychologist is very relevant it just depends on the kind of job that you're doing adune ngan haini se mayam
loinamak important way haidi sina kitang hena kaino mayam na pamnare market sina hena kaino lawyer habenate psychology every line of psychologist every time of psychologist is very important way habeni ko che
yes
mathang sina kai hana che tell us a bit about GAD and what kind of self therapy we can do
GAD generally stands for generalized anxiety disorder. See, anxiety disorder is one big, it's an umbrella term. Adugi makhada koi se generalized anxiety disorder laire. Aduga koi post traumatic disorder laire, and then phobias kainaga dono khangam gani. Koi hydrophobia, ishingi fear lai bani khangde, snake ki height ki lai khangde, closed spaces lai bani khangde. So it all comes under anxiety disorder. GAD su makhalam neba. GAD diagnosis to wo matamda koi se we had taken to me say GADs this anxiety ki problem se magi normal functioning de kyam queen kar ke 6 months hen bra habase yengeba aduga mi do du lai tar di mas atopa anaba lai bra habisu yengeba like thyroidism lai rasu lai ka ko aduga to pahana magi koi history de su ama substance related oi bra hana koi gi marijuana gumba cannabis gumba season narambra yu gumba am season narambra du ta GAD gumba se lakpa taweba or any other medical condition lai bra kind ka yeng seiba ko koina so GAD is mainly ko koi gi treatment basis se yeng bada you need to take medication as well as psychotherapy self therapy sidi nang na laakanda tamgadabane ba khoida because mi gi GAD se karam kanda hau
kaino habado makhangdringaida therapy di takpa yate ba proper analysis ma darkar tayo
yes, you need a proper analysis, understanding of your case history, nang background khang da ya de nang mamut se na nang kamai tor pano habadu khang da ya de so self therapy di kaya successful oigente so Yatari, if you want, you can just come up for better understanding. But ayamba matamda 6 to 8 sessions mukti change GAD gi akoina cater to bo matamda ko. So adumai tawrakanda dum mi se dum phagiba ki chances yam wange haidare mayam da thamningba ma.
Mathang type of depression ki matang da khra thambiramo haina comment nama lai chiche.
Okay.
Yaragadi kitang
Types of
haibiram.
depression say makhal se khoi gi kaino da lay. Depression, mild depression, moderate depression, the major depression high bam la ebako, and then depression gi type high tar mogi severity level high tar mild oi brana traga marakta oi yam thina sathina mi se yam thina kai high tar yam nungai tab se khamthen oi rabra ha se mogi severity level amadi lai jare aduga anda kai gumba kai no se yamna depression se am kuina lai rakpa chahi ani dorak tardi we call it diastemic disorder kind of chatkeba di kayani kai no se am kuina lai rakpa tari so course su yam laire nangi symptom gi su matung laire demarcation type of depression khai se depends on your symptom depends on the course of illness aduda basis oina torkani ba depression gi type se depression disorder oina laigani mild moderate severe adukanda and then yam nangi sangaga na diastemic disorder kind of lakani adumai thamni.
Okay. Okay. Thank you very much, Ichi. Mathang is na champa mai degi comment ni. Under depression or anxiety, some insist us to be friends or public. Rather, an individual refer to be alone. Please drop your opinion. Anxiety or depression like
yes,
imana basinga hai na. Si matanda kitang.
Yes, this is what I've been talking about. It's about seeking social support. You get your social support from your friends or your relatives or your parents or your siblings. So it's very important that you seek out help. Isai thandana I came to harakan the sum phumzala laitari ngasai su ngasai chitan balana su ngasai cover to it's not very good for mental health haibado. So if kaino haini itomta di lay bigano itomta lay gida maktani mayam sina koi suicidal kaino lakpa hore ise ko mayam haidokta khotaba tawbagini so ayamba matamda please seek out help that's one of my opinion di nungai taba like tardi haidoga ventilate tawraga su nungai ba phawbani ba aigi nungai taba singse so make sure that you please ventilate out your emotion to somebody you're close to somebody you think that who might understand you and you feel that if they are not understanding then please nang atopa professional amagadum tana biba mental health professional amagadum tana biba yagani ba. But please don't try to fight this battle on your own. You're a human after all, and we are all social animals. It's very important for us to have
to be social.
Social connection. Yes, resources, social connection like the Deva. So that's what I want to say to Archam Panme.
Okay. And the next question is MIT Noida a good institute to pursue clinical psychology?
Yes, that's a very good institute. Private way so you can still pursue your clinical psychology. You have to first finish your MA and then they have this MPhil clinical psychology, which is good that that it's been recognized by RCI. And the perk of doing MPhil in clinical psychology is that you get a good amount of stipend as well. So you get 25,000.
That's a very good news.
25,000 per month during your training period. So that is one incentive that you get.
Okay.
Not just MIT, but other institutes.
Okay. Hozikiduna aroiba question ori chiche yamna chiche na akogi MitSna se platform singi through the lapiduna mayangi doubts and they coming ba mayam clear to bibina makta chiche bungam khele tena MitSna get tarap tegi thagat phongdok chai chiche. Thank you very much.
It was all my pleasure. I hope whatever I said, whatever I've been talking has been a little help to any of you or to some of you. Say something. For any problems, you can please come to me, call me or contact me. That's what I want to say to all of you. Thank you so much, MitSna, for having me.
Thank you very much, Jay. We were delighted to help you. Have you here. Mayam, kaino da Tuesday da akogi Mac scholarship ki application process ki matang da session na matawjagani matam akogi page natraga Facebook page natraga Insta page da akoi shortly announce tawjaraki mayam loina magyaw view haina haijari ꯑꯗꯨꯒ ꯑꯔꯣꯏꯕ ꯑꯣꯏꯅ ꯉꯁꯤ ꯃꯌꯥꯝ ꯑꯩꯈꯣꯏ ꯚ꯭ꯌꯨꯋꯔꯁ ꯃꯌꯥꯝꯅ ꯌꯦꯡꯕꯤꯕꯩꯗꯃꯛꯇ ꯊꯥꯒꯠꯆꯔꯤ ꯃꯤꯠꯁꯅꯥꯕꯨ ꯃꯇꯦꯡ ꯄꯥꯡꯕꯤꯅꯤꯡꯕ ꯅꯠꯇ꯭ꯔꯒ ꯃꯇꯦꯡ ꯄꯥꯡꯕꯤꯅꯤꯡꯕ ꯂꯩꯔꯒꯗꯤ ꯑꯩꯈꯣꯏ www.mitsnahouse.com ꯗ ꯋꯦꯕꯁꯥꯏꯠꯇ ꯆꯦꯛ ꯇꯧꯕꯤꯅꯕ ꯑꯃꯁꯨꯡ ꯏꯃꯦꯜꯗ ꯄꯥꯎ ꯐꯥꯎꯕꯤꯔꯛꯅꯕ ꯃꯌꯥꯝꯗ ꯍꯥꯏꯖꯔꯤ ꯊꯦꯡꯛ ꯌꯨ ꯚꯦꯔꯤ ꯃꯆ